Good morning, good afternoon, good evening. Excuse my voice, this is Dr. Garais for BIO112, and it is the Unit 3 Anatomage, Muscular, and a little bit of the brain. Well, the cadaver for this particular unit is the male Caucasian, and we're going to isolate the muscular system. We already know how to do that. And in the muscular system, I am now about to go over all the basic muscles that you will need to know. From top to bottom, occipital frontalis, orbicularis oculi, orbicularis oris, masseter, platysma, deltoid, bicep, more anterior, tricep, posterior, brachioradialis. You could see it connects the brachium to the thumb side or the radial side. Pectoralis major, serratus anterior. Now, the muscles in the abdomen are in layers, so you will need to learn this tool to remove certain layers. So the top layer is the external oblique abdominal muscle. If you select external oblique, you click on this icon, and then this icon, and then you click on the external oblique, and then it disappears. And that leaves you underneath the internal oblique. Then I click on it again, then it'll move the internal oblique and then leave you with your rectus abdominis. And that is your straight muscle or your six-pack, also known as, six-pack or eight-pack. This is what we talked about regarding the muscles of the thigh. Oh, before we go to thigh, forgot the forearm. Muscles on this part of your forearm, those are all extensor. If you look at the muscles on the other side, they are all flexors. Now, let's now look at the muscles of the anterior thigh. The sartorius is your landmark. Big, long, S-shaped. Medial is this side onward, and your lateral is this side. Your lateral muscles, in this order, contain your vastus medialis, vastus lateralis, and your rectus femoris. And up top here is your tensor fasciae latae or latae. Here is not a muscle, but it is a ligament called your iliotibial band, and it's connecting from your ilium to your tibia, hence the term iliotibial. Now, from the sartorius towards the midline, these are the muscles you need to know. This short muscle here is your pectineus. Then you have the muscle here, adductor longus. And then the most medial muscle in your anterior thigh is your gracilis. And another muscle of note is here over your tibialis, and it's called your tibialis anterior. Sorry, picked the wrong one. Because this is posterior, this is anterior. All right, now let's change our orientation with the orientation button. Now we're looking at the posterior muscles. Occipital frontalis, then you have your trapezius here. Deltoid. Infraspinatus, overlying your scapula. Teres major. Here's the better view of your triceps brachii. Your latissimus dorsi. Gluteus maximus. Gluteus medius. And all the way down here, this is your gastrocnemius, which when you see the gastrocnemius, it's continuous with the tendon connecting muscle to bone. That is your Achilles tendon, and the bone right here is your calcaneus. Now we already know these as your iliotibial band and your vastus lateralis, the more lateral structures. And the most medial structure we already know is your gracilis. You had an adductor longus in the front, and in the posterior thigh, you now have an adductor magnus. You have your semimembranosus, more medial. Then you have your semitendinosus, and then your biceps brachii. And those are the muscles of your posterior. All right, let's minimize all this. And then, if you minimize, you have it here, so you can go back to it when you need it. Then you double click on the program icon, the Anatomage table logo comes up, and what we're now looking for, the instructions are a little bit antiquated. They're not antiquated, but we just updated all the menus. High-res anatomy is now called Pro Section. So you click on the Pro Section because we're looking at a 3D, and we're not doing any really cutting because you could cut the brain, but these are 3D photographs. You can't really cut them. So we already have the brain mid-sagittal section. Okay. Now, this is the brain. Now, how do you know the front versus the back? You see this area here, which is your midbrain and pons, is slightly angled towards the posterior area here. So, knowing if this is posterior, then you now know that this is anterior, so that's your frontal, parietal, occipital, right? Now, before we get into the other, now you may be wondering, where is your temporal lobe? Well, this is only the left hemisphere, so could I turn it around? And again, here, your temporal lobe in yellow, and you could see the pons right here, which is just sticking out, and that's going to form that little angle. That's how you know this is the front, parietal, occipital, right, and temporal. Okay? Let's bring this back. Look at these other structures. And this is one way you can take off all these labels. They're called annotations. So you can take this and remove them, and the colors will stay, but everything will disappear. All the, the words will disappear. Okay. So let's look at this. Here is your limbic system. That's your cingulate gyrus. Here is the connection between this gray area is the connection between your left and right hemispheres. That's your corpus callosum. It's the gray area. This area here, thalamus, right underneath it. Oops. Hypothalamus. This area here is the midbrain, and here's your pons. Now these are the structures that you'll be responsible for regarding the brain. Now, last but not least, what did this, another thing that the laboratory did, but won't be part of your, it's part of the lab, but not part of your final checkoff, is they went through functional anatomy and then they looked at kinesiology. So fast forward, get it to the end. Now, kinesiology means logi, study of kinetics, and kinetics is movement. So it makes you go over different movements of the body, and you can see what skeletons and what muscles are associated with it. Now, the only one that you really need to be responsible for You don't need to be responsible for all these other ones, but it is a flexion of your upper arm or your brachium. So we're going to be looking at the agonist, also known as your prime mover, the antagonist, which is the muscle on the opposite side, and the synergist, which could be a potential helper. So the synergist and the prime mover are working together. So if one's contracting, the other one's contracting. But between antagonist and agonist, in movement, the agonist is contracting and the antagonist should be relaxing. Okay, so you have these buttons here. Move this out of the way, right? And then they're matching up to different points, right? So we have that, and then you just play around with the movement, right? And you could press some of these buttons, right? And then this thing comes up. So this is shoulder flexion. Let me move this out of the way. So you can see this. This is shoulder flexion, and you can see, right, all the shoulder movements. So now you can see what's definitely involved in the shoulder movement. Let's press play. Deltoid, and you can also see lifting up the arm also involves your pectoralis major, right? But you saw who moved first. That's the deltoid. And that the pectoralis major could be seen as a synergist. All right, and that's just one example. You could click on all the other examples, and then they'll show similar movements. But this is part of the laboratory, but not part of the final checkoff during our week 5. So that concludes this brief overview. Any questions? Shoot me an email, of course. And if you want some extra practice time, a couple of minutes here, a couple of minutes there, doesn't hurt. Give me a call, shoot me an email so we can set you up in the lab. All right, have a good one.